Hello and welcome to Healthy India. I'm Sohela Kapoor. May 31st is World No Tobacco Day. The tobacco epidemic is one of the biggest public health threats the world has ever faced, killing nearly 6 million people a year the world over. More than 5 million of those deaths are the result of direct tobacco use, while more than 600,000 are the result of non-smokers being exposed to second-hand smoke. Nearly 80% of the more than 1 billion smokers worldwide live in developing nations, where the burden of tobacco-related illness and death is the heaviest. How successful are India's efforts at battling this scourge, which has even young children in its grip? Our expert panel to discuss this issue today are Dr. Manoj Sharma, Professor Radiation Oncology, Maulana Azad Medical College; Dr. P.K. Julka, Dean and Professor of Oncology, AIIMS; Professor Dr. K. Srinath Reddy, President, Public Health Foundation of India. And now, before we start this program, we have a package for you.
Cancer is a public health problem worldwide. It affects all people from the young to the old, the rich to the poor, men, women and children. Of the several causes investigated for cancer, the use of tobacco has shown strong and consistent associations with cancer at several sites of the body. These include lungs, the head and neck, urinary bladder and kidneys, uterine cervix, breast, pancreas and colon. Tobacco has been described by WHO as the single greatest cause of preventable disease. It has been universally regarded that tobacco is one of the major health hazards and is responsible directly or indirectly for an estimated 8 lakh deaths annually in the country. It has also been found that tobacco-related diseases and the loss of productivity caused therein cost the country rupees 18,500 crore annually, much more than all the benefits accruing in the form of revenue and employment generated by the tobacco industry. The tobacco companies add 80,000 new smokers in India alone to death row by their cleverly designed advertisements. Generally, it is accepted that if one does not succumb to the temptation of smoking till 22 years age, there is a slim chance of them ever taking up the habit. 5 million young people worldwide will pay with their lives for a decision they took when they were still underage. On average, smokers increase their risk of lung cancer between 5 and 10-fold, and in developed countries, smoking is responsible for upwards of 80% of all lung cancers. In a report from India, roughly 2/3 of all patients with lung cancer were smokers using cigarettes and/or bidis. Among 54 female patients, only 5% were smokers, reflecting both the low prevalence of tobacco use among women and the cancer-causing effects of environmental tobacco smoke. Early detection has been promoted as a potentially valuable intervention, but its cost-effectiveness puts it beyond the reach of all but the most wealthy healthcare systems, and even then pales in comparison to the cost-effectiveness of comprehensive programs and policies to reduce tobacco consumption.
Well, the illicit trade of tobacco products is a major global concern, as all of you know. And on World No Tobacco Day, there's an appeal to countries to work together to end the illicit trade of tobacco products. So, has India banned these products? Dr. Reddy, this question is to you.
Well, India is a signatory to the protocol under the Framework Convention on Tobacco Control. We have not only subscribed to the main treaty, but also signed the protocol. And therefore, we support the ban on illicit trade of tobacco, which anyway is an illegal activity. But the question is how to enforce it. There are a number of measures that are prescribed under that, both in terms of licensing as well as in terms of tracking and monitoring. And India now is beginning to enforce some of these provisions, but certainly it needs to be done very, very effectively, because the problem is not only with the fact that we are dealing with a very large country with multiple states and porous borders between the states and borders across the country, but also the fact that there's a multitude of tobacco products.
Yes.
And to have them appropriately tracked and monitored in terms of their labeling and identity is going to be quite a task for the enforcement agencies, but it needs to be done.
Right. Now, according to health experts, by 2020, almost 70% of tobacco-related deaths in the world will be in the developing world. Now, what is the reason for this, Dr. Sharma? Why are there more people dying because of tobacco in developing countries?
There are several reasons.
Because it's an expensive habit.
It has not been made so expensive a habit, because the way developed countries like USA have taxed tobacco, we haven't been able to do that. Actually, we need to tax it more so that we make it an expensive habit. There are multitudes of reasons why people are dying here. Number one, illiteracy and lack of awareness. That's one single reason. Because if you see and you talk to tobacco eaters, our problem is basically non-smokable tobacco, that is chewable tobacco, which has not been reflected in your piece. And that is the real threat. Smoking has, of course, as you say, the smokers are added, but not to that extent. So what happens? The poor socioeconomic strata that succumbs to the tobacco addiction, they are nutritionally poor. Their knowledge of detecting the disease or symptoms is very poor. They are not aware about it. And secondly, as is evidenced in our hospital, almost 80 to 90% cases they reach in late stages. Once they reach in late stages, the cure is impossible and death is obvious. This is number one. Number two, with population explosion, there has been an explosion of cancer patients also. And to meet the requirement of this poor socioeconomic strata, our hospitals have started having waiting list.
Yes.
That's the stark reality of the day, 5 months, 6 months. And cancer doesn't observe waiting list. It has to be, once it is diagnosed, it has to be treated. The delay in treatment, the delay in making up to the hospital, then poverty. Even if the patient is suffering and he knows he has got cancer, they are not able to come to the hospital because there were not enough of finances. Every day we see cases where the curable cancer is being treated and there is suddenly interruption of the treatment, the patient disappears. At times 40 to 60% non-compliance to the treatment because there were not enough of money to support themselves to be in metropolitan town. Most of the time you see that the patients rush to metropolitan towns, to big cities, to big treatment centers. Whether you are talking about the poor cancer patients or whether you are talking about the cancer patients who can sell their ornaments or properties and try to get treatment in 5-star hospitals. So there also there is a financial crunch and there is a disruption of treatment and the curable cancer, whatever, becomes incurable and ultimate result,
That's
is
really
death.
a pity. But Dr. Julka, there's also misdiagnosis. I believe a lot of cases have been confused to be tuberculosis. And when you take it's happened in my case. I took a very young boy to hospital and he was diagnosed for tuberculosis. He was given treatment for 2 years. When I took him to the hospital, they said, but a lot of these cases are cancer. It probably was never tuberculosis. So what do you do for cases like that?
Yeah, this is a common problem.
It's a very common problem. That's what he told me. Yes.
Because most of the lung cancer cases due to tobacco smoke.
Yes.
This is what we are referring to.
Yeah.
And they go to a GP or a general practitioner or I am not saying anything against the local
of course, yes, yes.
Doctors.
Yes.
They just put them on ATT, anti-tubercular treatment, and without diagnosing them as tuberculosis. And then they give it for 6 months. Patient of stage 1 becomes stage 4 and then lands to us.
But are the symptoms of TB very similar to that of cancer?
Symptoms of TB
so there is a
similar.
confusion?
There is a confusion because they can also have pain in the chest, or dyspnea means breathlessness. They can also have you know, like blood in the
Sputum.
sputum.
Yes.
So these symptoms could be similar: loss of weight, loss of appetite.
Right.
So what they do, they give it for 6 months, 3 to 4 months, and then by the time, because I always say cancer cells don't sleep, they keep on growing.
Yes,
You know,
of
you are not
course.
giving treatment for cancer,
Yes.
and then they land up with stage 4 lung cancer.
Yeah.
So we always tell our students 80-20 formula. 80% come in advanced stages, only 20% are curable.
Right. Right.
That too partially curable.
Right.
And the rest need palliative treatment.
Right. We'll be back to this discussion after this very short break. Don't go away. Welcome back to Healthy India. It's World No Tobacco Day on the 31st, and we are discussing the ill effects of tobacco consumption. For those of you who want to call in on this program, the numbers are, you can see them on your screens. The toll-free number is 1-800-11-5314, and the other number is 2303-5420. Hope you've noted that. And now before we proceed, I'd like to introduce the fourth member of our panel who's just joined us, and that is Mr. Amal Pushp, Director, National Tobacco Control Program, Ministry of Health and Family Welfare. Welcome, sir.
Thank you.
To our studio. Right. Now, Dr. Reddy, in India, nearly half of the cancers affecting men and 1/4 amongst the women are related to tobacco. According to Health Minister J.P. Nadda, who presented this report in the Rajya Sabha, children as young as 10 are addicted to it. So what is so addictive about tobacco?
Well, all forms of tobacco contain nicotine, which is one of the most addictive substances known on earth.
Right.
In fact, it's now known to be more addictive than cocaine or heroin. And in children in particular, it's been shown that even experimentation with one cigarette or one-time experimentation can actually induce addiction. So that becomes a problem. And for those who have already been enticed into the habit and have become sort of habituated to it, for them to give it up becomes difficult, not only because of the craving, but also when they attempt to give it up, there is a withdrawal syndrome. But it's possible to give it up, and it should be given up, despite the addictive properties, because otherwise it can be quite deadly.
Yes. Now, Dr. Julka, there is a misconception that nicotine, like Dr. Reddy said, it's very addictive, that nicotine is also cancerous. It's not the nicotine that causes the cancer, it's the other chemicals.
Yeah, there are 4,000 chemicals in the tobacco smoke.
Right.
And 40 or 50 of them are carcinogenic. They are chemical carcinogens.
Yes.
You have tar, you have formaldehyde, you have certain substances which you would not like to even eat, or even think of eating.
Right.
So these are chemical carcinogens which cause cancer. And nicotine causes addiction. As Dr. Reddy said, nicotine is the most addicting substance.
It's also a tumor promoter.
It promotes the tumor, it may not cause it.
May not cause it.
Right. But people tend to think that smoking is more harmful than chewing tobacco, gutka and pan. Is that true, Dr. Julka?
No. Both are harmful, because the chewing of, we call it smokeless tobacco. Smokeless tobacco, India is the hub of oral cancers. Why? Because we have more of smokeless tobacco chewers, like Khani, Zarda, all these. They keep it in the mouth, and then they get oral cancers.
They used to be advertised on television quite a bit in the past.
Cancers, and these are coming in ads also. So what I mean to say, smoking can lead to lung cancer, can lead to cancer of the esophagus, food pipe, stomach, prostate, even breast cancer, even cervix cancer, urinary bladder cancer, even myeloid leukemia can be caused by smoking. So what I mean to say, there are more than 20 types of cancers which can be caused by tobacco. And chewing tobacco is also equally dangerous, because we have enough evidence that it can lead to cancers of the head and neck. We already know it.
Dr. Sharma, which are the other non-cancerous and non-communicable diseases that you can get because of consumption of tobacco?
There's a whole lot of list.
Diabetes is one of them.
Heart problem, cardiac problem, lung problem, skin problem,
chronic respiratory
chronic sex-related problems, impotence, digestion-related problems. There's a whole list of it. But the point is, in spite of all that, and that is being spoken also in various programs, not of course so much as we wanted it to be popularized in general public, but despite that, people continue to either chew tobacco or smoke tobacco.
It can also damage your immune system, which
Certainly.
means that you can die at 25 years earlier than your
It damages the immune system because, as mentioned by Dr. Julka, the kinds of chemicals are there.
Yes.
They are all immunosuppressive. The very cause of leukemia, as he has mentioned, is because of the immunosuppression.
And you mentioned TB. It's been shown very clearly in studies in India and South Africa that tobacco consumption, especially smoking, increases the likelihood of TB getting activated in the body
Yes.
and increases the probability of dying early as well.
Yeah.
So in a sense, tobacco also abets tuberculosis.
25 years earlier means that's a quarter of a century.
Yeah.
That's in some people, it's literally half their lives.
But on every World No Tobacco Day, we always lay stress on cancer and cardiac. We never lay stress on infertility. We never lay stress on other causes, other what you were asking. So we should
Perhaps because infertility isn't such a problem in India at the moment.
Yeah.
Okay, can tobacco-related diseases be treated, Dr. Reddy?
Of course, I mean, many of the diseases can be treated, but they're best prevented. Clearly, when you're talking about cardiovascular disease, and heart diseases are the #1 cause of death from tobacco, even more than cancer. Not that we are competing, but then actually both of them are absolutely important. And if detected early, they can be treated. Several of the cancers, if detected early, can be treated now. But the most important thing is to prevent it. After all, tobacco is not essential for life. In fact, it steals life. Therefore, it's best to prevent it. But the good news is that it's never too late to give it up. People can give up tobacco at any stage in their life and still benefit from improvement in health. Best to give it up as early as possible, but at any stage in life, if you give it up, you're still buying some protection against heart attacks and some protection against
Some
cancer.
protection. Can these diseases be totally reversible if you give them up
Well,
after some years?
if people have given up tobacco before the age of 35 years, the risk of a heart attack is virtually abolished. The risk due to tobacco is virtually abolished in about 3 years' time. There's a 50% reduction in risk in 1 year's time. Cancer risk doesn't get fully reversed, and some of it persists even up to 20 years, but it is also substantially reduced. Therefore, best not to take up tobacco, and if you have already taken it up, better to give it up as early as possible.
Yes, Dr. Sharma, children as young as 10 have been known to ingest tobacco. They get to chew them, smoke bidis in the villages or where there is a lot of urban poverty and, child labor is used, in the cities. Also, children from poor families are employed in tobacco farms and are vulnerable to what is called green tobacco sickness. What is this sickness? Is it something that they ingest through the skin from the tobacco leaves?
You see, it's something like you must have heard about the desert medicine, where there is they are excavating salt out of land. And the salt is there in atmosphere, and most of the people in Rajasthan, where there is a desert medicine institute, people suffer from hypertension. Same thing happens with tobacco. The tobacco dust, the tobacco powder, and once in a while, that is how the children get addicted. Where they see elders succumbing to tobacco, or they are taking tobacco, the children all start taking. So it's all very comprehensive. It's all in totality. And about children taking to tobacco, I think it is about time that at least in the schools and colleges, we must intensify health education. At least that portion of children of metropolitan or bigger towns who are going to be potential tobacco users, they should be educated so that they don't become tobacco users. With regards to the laborers and the children of laborers, absorbing, there have to be very strong recommendations how they should be prevented from going to such areas, and they should also be given an opportunity to be educated. Their health checkups, their health care, all should become a part of it. Like for all the laborers, there is something like employee insurance available. This kind of insurance should be provided to them, and if this is a reality, the green sickness or whatever, then these children must be subjected to a regular checkup if we want healthy India.
Yes. Mr. Pushp, the UN has passed the WHO Framework Convention on Tobacco Control, or the FCTC. And over 1 billion people, or 16% of the world's population, is protected by comprehensive national smoke-free laws. So what are the tobacco control policies of the Indian government?
To inform you about the FCTC, in fact, India was in the forefront of the FCTC negotiations way back in 97 to 2003 when the FCTC was negotiated.
We've ratified it.
It was adopted in 2004. We ratified in 2004 itself. But even before its ratification, India had passed its law, which is called the Cigarette and Other Tobacco Products Act. It was, I think, it was a subsequent generation act of the old Cigarettes Act of 1975. But on the cigarette side, there were other tobacco products also added to include the other smokeless tobacco products. So basically, we had taken preventive action even before the FCTC was adopted by the international community. And India had a very comprehensive law in place, which also included all the FCTC provisions which are there in the convention. Most of the provisions, in fact, we had. And smoke-free policy was also a part of this law. But the smoke-free rules were notified sometime in 2008, and it went through a series of litigation before it was finally upheld by the Honorable Supreme Court of India, and then it was implemented.
Right. Was it known as the COPTA Act of 2003?
COTPA.
COTPA Act.
COTPA.
COTPA.
Yeah.
Okay, I stand corrected.
Cigarette and other tobacco products, and then prohibition of advertisement, etc.,
Yes.
regulation, etc.
Right.
Act 2003.
Yeah, we
This
see
is
a bit
the
of
act.
its effect because all the gutka ads that were coming so regularly have been controlled.
No, in fact, it is a very powerful act.
In fact, I don't see those
it has,
advertisements
It has
at
made a
all
lot
anymore.
of difference. Yes, it has
Made
made
a
a
lot
lot
of
of
difference
difference.
in
Yes, you don't see people smoking in public places anymore, or even in private places.
And
It is restricted in enclosed places and all that. And you won't see open sale or open advertisement
Yes.
of tobacco products.
absolutely.
Yes.
Well, we'll be back after this short break, straight after these messages. Welcome back to Healthy India and a discussion on the problems caused by tobacco consumption. Okay, Dr. Reddy, I believe you were part of the Indian delegation when FCTC was being negotiated, and you're also the author of a report commissioned by the Ministry of Health, a report on tobacco consumption in the country.
Yes, I did have the privilege of representing India as a part of the Indian delegation when the first public health treaty negotiated under the WHO was actually passed through. This is the Framework Convention on Tobacco Control, and the negotiations lasted between 2000 and 2003. Indian delegation had a very prominent role there. In fact, as the negotiations began, the world community thought that we would be opposing tobacco control or would be very lukewarm about it because India was a major tobacco producer and exporter. But India was so committed to tobacco control, and as Mr. Kamal Pushp said, our national legislation also was being evolved at that time. So the twin track approach of participating vigorously in the global negotiation as well as advancing our own legislation here domestically helped us take a very principled and strong stand in the negotiations. And in fact, some of the strongest provisions in that treaty, especially the ban on advertising and a number of other provisions, came through because of Indian leadership. And India won the maximum number of awards from the civil society for its leadership and was widely acknowledged to be one of the principal contributors to a strong treaty.
Congratulations.
And indeed, the treaty has number of provisions, which relate to demand reduction, like ban on advertising, and then also ensuring that there are strong pictorial rotating warnings, and also and public education, but also supply side measures, ban on sale to minors, and certain restrictions on other types of sale. But we also ensured that there was a provision there in the treaty that those engaged in tobacco farming and manufacture should be supported for moving to economically viable alternate occupations. Because that's also another argument put forth by the tobacco industry, oh, it will ruin the employment of so many people. We do have to be mindful of that as well, but not continue the tobacco production and tobacco manufacture. So we do need to steer them away from those occupations, and that also requires governmental effort apart from market support. So all of these are very well encoded in the treaty, and the report that you mentioned actually tracks India's tobacco epidemic, not only in terms of the consumption patterns, also in terms of the policies as well, over the last 40 or 50 years. And in 2004, it sort of provided the complete data on the situation related to tobacco. Now, of course, we are trying to update that report in a more contemporary fashion. But the threat remains. But we're happy that the Government of India, particularly the Ministry of Health, has taken a very principled position, as reflected not only in the treaty negotiations, but also subsequently in the enactment of the Indian law and the implementation thereof. But a lot more needs to be done.
So, Dr. Julka, in these 10 years, do you think tobacco consumption has decreased any?
No, we are getting more and more in developing countries, what we are talking. In US, the consumption has been steadily decreasing, you know, the smoking habits. But in India, we are getting more and more cancer cases, you know, like tobacco-induced cancers.
But why is this, despite all these efforts we were talking about,
because
anti-tobacco publicity campaigns?
This will take time. This will take time. Now, once
by the time it fruitions, it takes so many years.
Yeah, it takes so many years.
Yes, but like you said, cancer never waits.
Because, as I told you, cancer never waits, because now we see head and neck cancers, we see lung cancers, which we were not seeing earlier, because earlier not so many lung cancer cases we were seeing in 1970s and 80s. Now we are seeing stage 4 so many cases. But at the same time, we are also seeing early lung cancer cases. And there has been spurt in ladies' cancers also.
There is.
In women.
Yes.
Yes.
So there are more women smoking now.
More women smoking. And they are also getting, because still people don't know, breast cancer is #1 killer in India today, as of reports of today.
Yes.
Globocan 2012.
What about cervix cancer?
Cervix is #2.
Is number 2.
And in males, it is head and neck and lung are #1. Now, all these are tobacco-related cancers. So that is why we are seeing a spurt in tobacco-related cancers, which we are treating daily.
So what we're really saying is that these measures, probably, if we are educating our young, it might save this generation when it grows older, but the effects on the older generation are now sort of fruitioning.
No, what I mean to say
too late
that
for them. Is that what you're saying?
No, we have to target the school population.
Yeah, so
and they will target their parents, tell them not to smoke, because second-hand smoke or third-hand smoke also is dangerous.
It's very dangerous.
Yeah, it is equally dangerous. You can't say that passive smoking is not dangerous. If you are sitting in this studio and one person is smoking, all of us are inhaling the smoke.
I would also like to respond to what you asked, basically. When we say whether the consumption has come down, we do not have any reliable statistics as of now, because we conducted only one round of the Global Adult Tobacco Survey, that was in 2009 and 10, and we are trying to repeat it this year. So that will probably give authentic figures on whether the consumption has come down or whether there has been any impact of the efforts that we have made over the years. That will be a reliable estimate, I would say. Unofficially, we may say whether the consumption has come down or not come down, but official figures will come out only after the second round of the adult tobacco survey, which we are going to conduct.
But there are some disconcerting figures about consumption of oral tobacco going up in women.
Yes, Dr. Sharma, you wanted to add something?
There are a couple of things I wanted to draw attention towards. Number one is, you don't expect figures to improve despite all these laws and rules, because we have given enough of time for people to get addicted, and a huge population to get addicted, and that population is transmitting its habits to the younger generation. School health education and what I call school cancer education. When Delhi government, we did a school cancer book, awareness book that was called Cancer Ki Kahani Jo Hai Bachchon Ko Sunani, and it was very effective. It's almost 10 years old, and we third or fourth edition. So, you know, once that population is already using tobacco and more is getting added, you don't expect the picture to improve. This is number one. Number two, just small little survey here and there is not going to help. I have been harping and insisting that when we know that the tobacco causes cancer, we have to declare cancer as a notifiable disease. Once we declare cancer as a notifiable disease, once at the level of primary health center, the doctor sitting there identifies TRCs, tobacco-related cancers, once the Anganwadi worker or a primary health midwife knows what cancer looks like and it is properly reported, it is connected to National Cancer Registry project, and we get a clear-cut picture, it's too early to say that all these efforts which are being made, continuously, perpetually they are being made. We are not going to get the correct picture. New population of tobacco users will be added because of many other reasons. Educating people on tobacco is not going to help, because there is a huge population of uneducated people who are refusing to be educated. They are laborer class, they are poor people, they are farmers, they are workers who are not going to listen to your education. They will still continue to get addicted to tobacco, and that is why the impact which we are anticipating is not going to come. Therefore, in my opinion, as Sir has suggested, giving them an alternative profession, it is about time, 66 years. What are we doing? We have not been able to convert tobacco fields into something useful fields. We have not been able to take care of those 4 million people who are involved in tobacco industry, to put them somewhere else.
Even the children now.
Even the children. Why are we not, ultimately, I have a feeling, because we will be beating around the bush, I tell you. Unless and until we seriously think on total tobacco ban, we will have these programs every year, and we will be discussing the same thing again and again.
One thing I would like to say is that
Out
of 12 lakh new cancer cases per year in India, 40% are tobacco-related cancers. So we talk of prevention of cancer. This is the way, primary prevention. We know the cause, but still we are not doing enough.
No, I don't understand. Why can't we ban the tobacco? Dr. Reddy was telling about the money spent, the revenue spent on treating tobacco-related diseases, which include heart, lung, cancer and all. That is much more stupendous than what revenue is earned from tobacco. Why are we not able to take this step? We have been observing No Tobacco Day for almost 2 decades now, WHO. And we are still not able to do anything.
Mr. Pushp, what's your answer to this?
No, that is because, as Professor Reddy pointed out, it is also a question of employment of people. And the government has to take a balanced approach. Has to take a balanced approach. Unless that alternative is provided to them, it's very difficult to straight away ban it. And many countries' experiences have shown that ban may not be an appropriate answer, because when you ban something, people find clandestine ways of obtaining that product somehow.
Of course.
So ban may not be a very appropriate solution, and all these policies of demand reduction have been proved effective in many countries abroad. In India, it is compounded. The problem is compounded by the variety of the tobacco products available also. And some things which were earlier customary, like hookahs were customary in countrysides earlier. Our old generations used to smoke them, but now
Pan is also a very old habit.
Pan is a very old habit. So these are customary habits. But what has happened in recent times, like if you see, some people are trying to commercialize these products, like opening of hookah bars or hookah parlors. Now this is commercialization. Because hookahs were a traditional
Yes.
mode of smoking earlier. It was confined to a countryside. Very few people knew about it.
Now
very
it's
few
considered
people
very
used
upmarket.
it. Now it is
In
considered
restaurants, yes.
fashionable. People are getting enticed to it. Youth are getting enticed to it. It is a very fashionable thing to do.
We have a lot of
So
hookah
it's
bars
a lot of
coming up.
challenge. There is a lot of variety in Indian context. It is very difficult to have a victory over all these.
Also, in pan
trends.
chewing, you have a variety of pans which are being offered. They're
Yes,
getting
yes,
much more
yes.
expensive than they were, and they're far more exotic. But they do have the
No,
tobacco.
but with pan, I must tell you one thing.
content.
Unless until pan contains tobacco,
Huh.
it's an Ayurvedic medicine for your kind.
I see. That's it. We'll come back to this interesting point right after this break, which is going to be our final break. Welcome back to Healthy India and a debate on how tobacco consumption can be contained. Dr. Sharma, you were saying that pan is not dangerous unless, and it's not cancerous unless it has tobacco. So you're saying that all pans do not have tobacco.
No, if you take pan with tobacco, then it is dangerous.
You have to ask for the tobacco in the pan.
Generally,
Right,
the pan
okay.
is the
And it's healthy, you
catechu is demulcent.
Yes.
The lime which is used, it's all harmless. It works as a calcium, and pan leaf has itself got Ayurvedic characteristics.
Properties, yes.
Properties. So pan as such, if it is taken properly, it is not carcinogenic. But once it is added to tobacco, and tobacco in many forms, like leafy tobacco, there is one thing called a tobacco paste called kimam. Various kinds of tobaccos are added to it, and it is basically, pan is just a carrier for tobacco addiction. So that way, I will certainly not recommend
Banning
tobacco
of pans.
bomb. No.
So they put
No.
the tobacco in.
Yeah, you have to ask for it also. Okay. Mr. Pushp, I just wanted to ask you that despite a substantial duty being levied, on tobacco products, we've had excise duty, VAT on them, it has not really reduced the demand for tobacco. What is the reason behind it?
No, in fact, if you see the trends over the past few years, there has been successive increases in the excise duty on cigarettes. But the increase in excise duty on BDs has not happened. Moreover, the excise duties on the chewing tobacco products is not adequate to our understanding, and that's why we have been taking up with the Ministry of Finance, which is the taxation ministry of the Government of India, and we have also been taking up with the various state governments on this issue. And we are asking basically the state governments and the Ministry of Finance to evolve a tax policy on tobacco products, a tax policy which makes it less affordable over a period of time.
Works as a deterrent.
Works as a deterrent, and it is linked to some kind of inflation, the affordability index, so that there is a real increase in the price over a period of time, and the affordability comes down. That's the kind of effort we are making, and hopefully someday it will come, it will evolve. Yeah.
Okay, now health is a state subject.
Yes.
But the central government has decided to aid the states. So what are the programs that supplement that of the states? The central programs that are supplementing the state programs.
Basically, the National Tobacco Control Program is one. Then we have also one national program for control of cancer, cardiovascular disease, stroke, etc., which is basically a cancer program, NCD, Non-Communicable Diseases Program it is called, and National Tobacco Control Program.
What
they
is the
both
national-
complement
yes,
each other.
Yeah.
Yes.
What is the NTCP, that's the National Tobacco Control Program, and how is it aiding COTPA?
National Tobacco Control Programs, the basic structure is that we target awareness generation, capacity building of the enforcement staff at the state level, at the central level, and also training the people for this purpose. The basic structure is that we have tobacco control cells at the national level, at the state level, and in the district level. And it is complemented by, as I said, National Program for Control of Cancer, Cardiovascular Diseases, etc. They are also working on the same lines. The basic concept is awareness generation under NTCP. That's the structure.
Okay.
Yes.
Dr. Julka, on a personal level, how can one kick the habit? It must be very difficult if you're addicted to it.
It's very difficult, as we already talked about. Nicotine is highly addictive.
Yes.
So basically, I'll give you one example of one of our doctors who had pain in the chest. He used to smoke 20 cigarettes per day. He had suddenly pain in the chest. From next day, he said, I will not smoke. And this is the willpower which one needs to quit smoking. Number one. Number two, there are counseling sessions. We have a de-addiction center at Ghaziabad, AIMS, de-addiction center, psychiatry department runs it.
Yes.
And they are doing counseling for it. And there are nicotine substitute, replacement therapy we call it. Nicotine gums, nicotine, different types of nicotines. Patches, gums, and all these. So what I am saying, that person should know where to go if he wants to quit this smoking or quit all these tobacco products. So this is very important that we must tell them through electronic media, through print media, that there are centers. They can go to psychiatrist, any psychiatrist who will help them. They can go to any medical college. All medical colleges in India, some of them, most of them have psychiatry department, and they can go to our de-addiction center which we have, which can help them quit.
Would you like to add to this, Dr. Sharma?
No, I think we should be more realistic and go to the statistics. The success rate of de-addiction through these de-addiction centers, it's very poor. People go back to smoking, go back to addiction. I think more important is that in addition to de-addiction center and counseling that has to go on, there should be some amount of awareness that should be created that the tobacco users should have some kind of an annual health checkup. At least the disease which comes to us in a late stage can be detected earlier, or there could be some correction at the level of nutrition if they are undernourished or malnourished, or if there are changes which has happened, already they have happened, say like submucous fibrosis, leukoplakia, erythroplakia in tobacco chewers, or there are some changes in the X-ray chest or in ECG or heart. These checkups should be made more, should be more popularized, and in that time, at that point of time, you can do medical intervention, therapeutic intervention, and that's the point where you can actually convince the fellow that, look, this has already happened and you are in for this kind of a problem. So I think that will be more effective, because if you see the de-addiction statistics, it's very poor, number one. Number two, you know, if you want to establish de-addiction centers, the amount of infrastructure, the expertise, the staff, the psychiatrists, there is a shortage of psychiatrists in this country, psychologists in this country, clinical psychologists are not available. So you see the human resource and infrastructure is so much, it's so stupendous that
it becomes very difficult.
It's very difficult.
Yes, quickly, very quickly, Dr. Reddy.
Well, firstly, I agree that de-addiction now needs to be part of a regular community-based health program.
Yes.
Second, because many of our tobacco consumers are low education status, low literacy status.
Yes.
We need to put in very strong pictorial health warnings on the tobacco packages, because that will actually give them the graphic image of what harm tobacco can do and set their minds thinking about giving up tobacco.
Yeah, the very strong messages that are coming in cinema theatres before films now. They're doing it very regularly, even on television.
That is also part of the NTCP.
Yes, yes.
Everybody cannot come for a health checkup.
Yes.
You know, 1.2 billion population, how can you expect everyone to
but you have to initiate, Dr. Dulka, at one stage you have to initiate.
That is what
otherwise your cases will keep coming in
I would
last
like
stage.
to respond to this also. Basically, under NTCP, We are going to set up a
Yes.
national level quit line also, which will be a
Okay.
toll-free number.
Right.
And we are probably targeting at opening that quit
Right.
line in a period of 2-3 months' time
Okay,
from now.
that's great news. But for those who have tuned into our program now, here is a capsule of what we have been discussing.
Larynx, oral cavity, pharynx, esophagus, stomach, pancreas, cervix, kidney, bladder, acute myeloid leukemia. Symptoms: any change in cough, a new cough, coughing up blood, hoarseness, trouble in breathing, wheezing, chest pain, loss of appetite, weight loss, feeling tired all the time, frequent lung or respiratory infections. Why quit smoking? Quitting smoking has major health benefits that starts right away. Former smokers live longer than people who keep smoking. Quitting smoking lowers the risk of lung cancer, other cancers, heart attack, stroke, and chronic lung diseases such as emphysema and chronic bronchitis. Women who stop smoking before they get pregnant reduce their risk of having a low birth weight baby to that of women who never smoked. The health benefits of quitting smoking are far greater than any risks from the weight gain or any emotional or psychological problems that may follow quitting.
If you have any questions relating to this program, you can write to us at this address.
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com and our toll-free number is 1800115314.
Well, thank you everybody for joining me in this program in the studio for this extremely informative talk. And that's all in this episode of Healthy India. We will return next week with another relevant topic. But before we leave you, here is a lyrical message on quitting consuming the poison of tobacco.